Eric back at the naturopath. Thank you for coming back. A question I get asked quite regularly, particularly when I was practicing, is I've got joint pain. I've got pain in my joints, in my hips, or in my lumbar spine, or it could be in my knees, it could be in my finger joints. Can this be ameliorated or remedied by diet? If I change what I'm eating, is there any link between this pain and my gut function? So, well, if you think about it, we've often spoken about the fact that the majority of your immune system resides in your digestive tract, particularly the small intestine. There's a large chunk of it in there. And this is often where inflammation starts, right? Especially things that we've discussed in previous videos like lipopolysaccharides, LPS, or small fragments from bacterial walls that end up leaking through or causing havoc with the immune system. And these upregulate in pain, inflammation, so you're going to get a cycle going. So many experts now believe that lots of inflammation in general, especially as you get older, sort of my age plus in particular, will push you into chronic health, chronic disease like cancer or diabetes or heart disease or things like this. So by keeping your gut in good shape, especially by eating the right kind of foods and understanding the connection of lifestyle and gut, by really getting that working well, you can reduce your chances of inflammatory disorders. So how do you know you got inflammation? Well, pain, like pain in the hands, or just pain in fingers or wrists regularly, could be pain in the elbow, or just regular pain, small amounts of pain, small bouts of pain. And this pain can go on sometimes for days, it can disappear. You may get those pains, in different parts of the musculoskeletal system. So is there a link? Well, here's the interesting thing. I totally believe there's a link between the gut and most inflammation throughout the body. Personal experience also from reading thousands of stool tests, looking at reports of patients, talking to them about their problems, and seeing the connection with Klebsiella, with Citrobacter bacteria, like for example high counts in the stool, and then very painful fingers, or very painful wrists, or very painful hips. Or it's known now, it's actually a known fact that people with rheumatoid arthritis have got Klebsiella in their gut, and the Klebsiella contributes to the inflammatory component of the autoimmune disease. Most people know that now. I knew that 20 years ago. I didn't know it was Klebsiella, but I had a gut feeling, for want of a better word, that bacteria are involved in a lot of these autoimmune inflammatory diseases. So remember, there are two types of inflammation you can get in the joints. You can get wear and tear, the osteoarthritis, or you can get the autoimmune, which is more they both have inflammatory components, both those types of arthritis, except one is autoimmune, one's non-autoimmune. But you can also have pain in the joints that's not osteoarthritis, that's not rheumatoid arthritis, that's still pain. And I still believe that there are conditions like that throughout the body where you'll get little bits of pain. But if the gut's in great shape and you've got the gut restored in good condition, those pains go away. Check it out. Get a stool test done. If you've got pain anywhere in your body now, get a test done and have a look. You might be quite surprised. You set your house in order and it starts coming right. Thanks for tuning in.